Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. And as usual, today I have with me here my friend again.
Collins.
All right. Yeah, so by popular request, a lot of you have been requesting for the de-escalation station. After the 19th of September, there were some changes that were made to the Mental Health OSCE, and pertaining to the skill station, de-escalation and then suppository were the ones that were kind of affected. The suppository was taken off and the de-escalation is now more like a skill, actually an actual skill station that you have to do now. I've seen a lot of your comments requesting for de-escalation, but of course, if I don't get Collins, I wouldn't be able to do it because it's now an actual skill station.
Yeah.
So today I have Collins with me here, and as usual, we are just going to demonstrate it for you to see exactly how the de-escalation station is done now. So Collins will be my patient for the day, and of course, I'm going to be the one to perform the procedure. It's a very, very, very simple skill station. In fact, it used to be the easiest skill station because it used to be a skill, but actually it was written practically, but now you actually have to do it. So without wasting much time, we are going to go straight to the video. If you don't know what de-escalation is about, it's just basically a patient who is kind of agitated, who is a bit irritable, and is usually pertaining to something that he wants to do or he needs, but then at that point that cannot be fulfilled. So I have my patient here and we have a scenario here. So I'm going to read the scenario and then you know exactly what is making Collins irritable, and I'll have to de-escalate that particular situation as a nurse. So basically, the scenario says that you're a mental health nurse on the acute admission ward. Mr. Collins, who goes out every single day at exactly 10 a.m. to go and see the rabbit in the field, today is told by the nursing assistant that he cannot go out because it is heavily raining and the winds are quite strong outside. Collins doesn't understand this. He's angry, he's kicking at the windows and wants to go out. As the mental health nurse on duty, go and de-escalate the situation. So as simple as this. Collins here is angry because he loves rabbits. Every day he goes out to see the rabbits in the field. But today it is heavily raining and the winds are just too much outside. And the nursing assistant has said to Collins that he cannot go out. And because of that, he's angry and, you know,
Agitated.
very, very agitated, kicking at the windows. And I am the nurse on duty. They've come to inform me that this is what is happening. And I need to come in and talk to, you know, Collins, more or less like a verbal de-escalation. So I am going to start the scenario, how you are supposed to do it in real exams situation. Knock, knock. Is the nurse? Can I come in?
Yeah, you can do whatever you like, yeah.
All right, so I'll come in. I'll check for scene safety. The scene is safe for myself and the patient. Hello, Collins. Can I have my seat?
Yeah, you can. Yeah, you can. Sure, you
Right.
can.
I'm just here to talk to you, Collins. Collins, how are you?
I'm not all right. I'm not all right at all. I usually go out by this time at 10 o'clock to see the rabbits, and everybody knows this. And it's care planned, but still, they're not telling me that I can't go out. It feels as if you guys are keeping me a prisoner here. It doesn't make any sense. I should be allowed to go out when I want to.
Collins, I can understand your frustrations. That is why I am here. The nursing assistant has told me everything that happened, and I know how much you love your rabbits, and every single day how you go out to go and see them in the field. Yes, I know you love them. I understand your frustration. But Collins, at this time, it is heavily raining outside and the winds are quite high. It is lifting things and throwing them up down. In as much as we want you to go out and see, or to go and see the rabbit, which I know you love so much, we are also looking out for your safety. You know, safety comes
I don't
first.
know what the rain has to do with me. It's just rain. Not as if it will hurt me. It's just rain. I can see the rabbit. It doesn't concern me.
Collins, I can understand that, and then I agree with you. But then, in as much as we want you to go out, the rain, there are so many things. If you go out now, can happen. One, if you're walking out in the rain, the winds are so high, it can just pick up anything and then throw it out at you, which we don't want to happen. Secondly, if you even get to the field, the rabbits are not going to be there, because usually when it's raining like this, the rabbit runs and then they hide in their holes and then they will not come out. So if even you go out right now, there is no way you are going to see them in the field.
But I'm bored. I'm bored. There's literally nothing to do. I'm bored.
I can understand that. That is why when I was coming, I came with this particular tablet. There is, a documentary on rabbits in the field, which is a very nice documentary. I can just show you here. As you can see, this is the documentary, and then you can see the rabbit. There are even more rabbits here than you usually see on the field. This is about 1 hour. And then I'm going to leave this with you so that you can have a look at it. I know you love rabbits. There are so many documentaries here. There are so many options here which you can choose.
But can I still go out once the rain stops?
Yeah, exactly. So for now, I'm going to give you this whilst it keeps you engaged. Immediately the rain stops and it's safe for you to go out, we'll make sure that you go out to go and see the rabbit. Do you think this sounds like a good plan, Collins?
Yeah, it's all right. I can manage this till the rain stops. Yeah.
All right. Thank you very much. Collins, is there any other thing you want me to do for you?
No, there's nothing else. That's just it now.
All right. Thank you very much. And then when the rain stops, we'll see how we'll be able to facilitate your leave for you to go and see your rabbit. Is that okay?
Yeah, it's all right. It's all right.
All right. That's fine. In that case, I will take my leave, but then if you need anything, don't hesitate to walk up to any of the nursing staff or just make use of your call bell and then we'll attend to you. Is that all right?
Yeah.
Right. Thank you very much, colleague, for understanding. All right, I'll leave now and I'll see you later, okay?
Okay, no problem.
All right, cheers, bye.
Bye.
All right, so welcome back. As you can see, this is how the de-escalation is done. Basically, you saw how Collins was angry because he could not go out to see the rabbit, which he normally does every single day. And you saw how the nurse came in to speak to him to kind of de-escalate the situation. The most important thing is usually you trying to provide alternatives if you can, or provide some form of distraction or use some form of distraction techniques if you can. And you can see that that really help with the situation. So basically this is just what you are expected to do. It's a very simple skill station that you'll be able to do. Just know what the marking criteria entails, and of course you'll be able to sail through that. Anything to add, Collins, before we conclude?
Well, it's pretty much everything, but then you should understand that settings differ. Sometimes your patient in the actual exam might be standing up, they might be pacing around, they might be aggressive, and then if you go by the marking criteria, you are meant to actually find a quiet place. So you just say it out to the examiner, I'm meant to offer the patient so that we can go to a quiet place where we can discuss his or her issues and find a solution to them. Okay, so settings differ. So that is why it's good to know the marking criteria and then work according to the marking criteria. But this is pretty much everything that you were expected to do during the exam.
Exactly. All right, so if you've not subscribed to the channel, please make sure you subscribe to the channel. Just turn on the notification bell, and anytime I upload the video, you'll be notified and you'll come straight here and take a look at the video. Until we see you in our next video, it is a bye for now.